You have to be a sucker to believe, Tucker. Fox News host Tucker Carlson told viewers Thursday night that public health experts should not make the big decisions amid the coronavirus crisis because that's not their job. What would have happened, for example, if we would have adopted a more conventional response to the epidemic? Carlson asked his viewers. What if we asked the elderly and the immunocompromised, sorry, that word tripped me up, and anyone else facing statistically higher rates of risk to stay inside, cloistered away, and at the same time allowed the rest of the population to use informed common sense and continue to work? What if we'd done that a month ago? Would the death rate today be much higher than it is now? Maybe, maybe not. We don't know. He added, but it's clearly a conversation we should have had before we locked the entire country down and put 10 million people out of work. But we didn't have that conversation. Instead, we outsourced the decision to public health officials. And that's a strange irony of the moment we're living through. One of the main lessons of this crisis is that the public health establishment failed us badly. Carlson cited two examples where public health officials allegedly failed to rise to the occasion: the ability of the Centers for Disease Control to produce the number of working coronavirus tests necessary to meet the pandemic, and accusations that the World Health Organization followed the Chinese government's lead instead of challenging their narrative about the COVID-19 outbreak. So I think it was very difficult to get a coronavirus test, and I'm not going to try to pretend it wasn't. But the idea that people who have a background in medicine apparently would not be as qualified as individuals who outnumber them via being the general population, I think is pretty ridiculous. I don't consider myself to be dumb in the slightest, but I would never take my, what's a good word for it, intuition over that of a doctor or some organization of health experts, because I think those people largely act in a very bipartisan way to try, like there's no money to be made from people dying and just being at least in the US domestically anyway. So the idea that we were just all going to be, so, and this is what I really hate about a lot of the conservative stuff, where they try to pretend like the public doesn't panic and they're these very organized individuals, when the reverse is true. There was a widespread panic over toilet paper when people thought that apparently this was going to turn to something where we were all going to be forced to just stay in home no matter what. And just by that example, you can tell that you were never going to get all the people to come together and say, let's make sure that those who are compromised and are elderly stay home while the rest of us go out and work. I get it. He's upset that the economy is tanking, and so are some other people, but I don't see how deferring the, what do you call it? What's a good word for it? Responsibility for handling the crisis to regular individuals who have shown they are not organized would have been any more effective than what we're doing now. So this was I think, fairly bad take, but his criticisms about the CDC and the World Health Organization are pretty accurate. I will admit that, because these agencies, and I guess in their defense, they didn't really have a precedent for doing this. As far as I can remember, we haven't had anything in the last several decades like this. So because of that, I am a little bit more forgiving than usual.